Good evening. Welcome to another exciting session. We're going to have a lot of great information for you today. Today we're talking about hyperbaric oxygen and better vision. So we're going to talk all about hyperbaric oxygen. What is it? It's something you probably, maybe you've heard of it, maybe you haven't. So we're going to talk about first what hyperbaric oxygen is, and then more specifically what it can do to help you and how specifically it can help your vision. So let's dive right into this. Again, if you guys are logged on live, feel free to comment, ask questions. I'll be monitoring the questions as well inside the questions section. Where you could be either putting your questions in through Zoom, you could put your questions in if you're watching this in the Facebook group, if you're watching this on our YouTube page and watching this on a recorded version, feel free to reach out to me and send me an email or call our office if you have any other questions. So let me queue up my PowerPoint here and start my screen sharing. Get that going and start from the beginning. That's now. Okay, so here we are, guys. Hyperbaric oxygen for better vision. All right, so I'm making this a two-part series. Why? Because this is a lot of information. Most people probably have never heard of hyperbaric oxygen, so you're not familiar with what it is, how it works. So the first section that we're going to do is we're going to break it down into what hyperbaric is and how it works. Okay. The second section, part two, we're going to really focus on how it's specifically useful and beneficial for your eyes and for your vision. Sound good? Awesome. Okay, so let's move forward. What is hyperbaric oxygen therapy? Well, what we see right here, this is a soft hyperbaric chamber. This is what it looks like, this image here. They inflate kind of like the bounce houses. So we're basically pumping oxygen and air into these soft units, and they basically inflate. So they go from a deflated state to an inflated state. Most of my patients, I use it all the time now. It's kind of like being in a fort, or it feels like being in an airplane because the pressure does increase. We're going to talk about that in a little while. So when we get in, you just feel like you have to clear your nose a little bit because we're increasing the pressure. But as you can see, there's a lot of room here. It's not really this super tight, confined space. Once it blows up, you can move around. Usually you get two people, definitely like a parent and a child. Last week we even had two adults in there, so kind of going like head to feet. It's a little tight in there, but for these units, that's what it looks like. I wanted to give you guys a visual on what hyperbaric what it looks like. So that's what it looks like, and what it is by definition is this: hyperbaric medicine or hyperbaric oxygen therapy, which is HBOT, is a medical treatment. That's right, it's a medical treatment in which an ambient pressure greater than sea level, ambient means more air pressure, compression, greater than sea level, so it's sea level, there's regular air pressure, we kind of feel it as where we go below sea level, there's more pressure, we go up in the mountains, there's less air pressure, that's why it's harder to breathe, people get altitude sickness, stuff like that. So it's greater than sea levels atmospheric pressure, and this is a necessary component to the treatment. We'll explain how and why it works. So basically, in short, what we're doing here is we're dosing and amplifying the amount of oxygen that goes into the body. And it's called dosing, all right? The amount of, we're actually using medicinal quantities of oxygen to get it into the body so that we can heal the body. We're going to talk about how that works. So the dosing is contingent upon three factors: oxygen, pressure, and time. So that's how much oxygen is in the chamber. Usually in air, normal air we breathe is about 21%. We're going to add more oxygen to that. So it can go from 21% all the way up to 100% oxygen. Then we add pressure. Okay, we're going to talk about specifically, because it's very, very important. The amount of pressure we add is going to determine how much time you need to spend inside the chamber to get the dose of oxygen into your body. Okay, so we have oxygen in the chamber. We have this ambient pressure or pressure gradient that we're going to talk about how that works over time, that enriches and creates an abundance of oxygen in the body. Let's move on. So there are two types of hyperbaric oxygen chambers. If you guys have ever heard of them, or you've seen them, or you've Googled them, you've probably been more familiar with the hard chambers, right? Or the hard shell chambers. Now, the hard shell chambers are usually what's found in most hospitals, or any hospitals that are using it. These are real, the industry standard or medical grade. Any physician who you will usually refer out or recommend for hyperbaric therapy for somebody who's either had, bends, we're going to talk about conditions, the bends from diving, or they've had, some necrosis or gangrene or non-healing ulcers or burn victims, so on and so forth, like really, really aggressive types of conditions, maybe advanced cancer, forms of cancer now they're using for. We need a high amount of atmosphere. So when we say atmospheres, we're talking about pressure, okay? So 1 atmosphere is where we're at right now, right? That's sea level. As we go up higher and higher in the mountains, it could go to like 3/4 of an atmosphere, or even up to half an atmosphere. So when we go down to sea level, we add atmospheres. So we go from like 1 atmosphere, like 10 feet underwater, will be like maybe 1.2, 1.3 atmospheres. You go down like another 25 feet, maybe about 100 or 1.5 atmospheres. So these medical grade hard shell chambers are used for severe medical conditions, and they really can withstand a very high degree of pressure, right? So that's why they're hard shell. They need to withstand that. Often in these hard shell units, we're using, not always, we can use less oxygen, up to like, I don't know, 35, 40%, but we can also get up to 100% oxygen, which is going to be very therapeutic and very important for severe situations. Again, like gangrene, maybe the bends from too much, when divers come up too fast, that's a disease they get. So there's a lot of conditions we'll talk about, but hard shell it's obviously a lot more expensive too. Clinically, they run about $100,000. Then we have the soft shell units that usually run, anywhere from about maybe $15,000 to $30,000. These are more portable. They're just as effective, right? The maximum pressure that you can get in a soft shell is 1 to 3 usually. Some of them can go up to 1 to 5, but usually the medical standard is to get to 1.3 atmospheres, which is pretty much 4.2 PSI, okay? So the higher the PSI, the more pressure that we're creating. And the more pressure we create, the more oxygen that gets pushed into the body. I'm going to talk about that mechanism. So for right now, I just want you guys to know with this slide the distinctions between a hard shell and a soft shell. And both work. It's not necessarily one is better than the other. It's which is going to be relevant for the specific condition. And obviously, the hard chambers, you can get the pressure high and more oxygen. So ultimately, you need to spend less time in there. Soft shells, you just may need to spend more time to get more oxygen dosing into the system, if that makes sense. Okay? So let's move on. Let me know if you guys have any questions on that. So principles of hyperbaric oxygen. So the principles are based on these gas laws, okay? We have a picture of a seltzer bottle. That's a useful analogy, and I'm gonna get there in a minute. Now you guys are like, what does that have to do with this? It has a lot to do with it. So bear with me for a minute. So there are 2 laws I wanna talk to you guys about. There's Boyle's law and Henry's law. These are both extremely relevant and specific when we're talking about hyperbaric oxygen therapy. Now let's look at Boyle's law first. Boyle's law states that at a constant temperature, gas pressure and volume are inversely related. What does that mean? So that means in a space, the volume of space expands when the pressure decreases. Okay, so if there is more compression, a compressed space, we're going to have a higher volume of gas in that space. In this case, oxygen. If we have a larger space, it's going to diffuse. We're going to have not as much pressure and not as much volume. Okay, so we have, it's pretty obvious. This was, again, I think this is in the 1930s or something like that. This law came out. Don't quote me on that. I'm not 100% sure. But anyway, what it says again is that when we compress a gas, it means it's more dense. Right? Obviously, there's more concentration. when we expand the space and there's the same amount of gas, it's just more diffuse. Okay, makes sense. So then we go to Henry's law. Henry's law says that at a constant temperature, again, why is temperature important? Because we know that when gas expands with heat and contracts with gas. You guys know that in wintertime with your tires. When it gets cold, we need to fill our tires because the cold air compresses and our pressure in our tires will decrease. So we need to add more air to our tires. Likewise, in the summer, maybe the pressure can get too high as the air expands. So there's an analogy for you. So Henry's law again states that at a constant temperature, the amount of given gas that dissolves into the given type and volume of liquid is directly proportional to the pressure of that gas equilibrium in that fluid. So what does that mean? It means that the partial pressure increases as the gas dissolves into the liquid. So this basically shows what we're talking about here when we use the seltzer bottle analogy. So you guys have probably seen this. They sell like Bed Bath & Beyond or any place you guys make your own seltzer. We have these carbon dioxide cartridges, and you basically just put water in there, tap water or spring water, whatever you guys want. Tea if you want a carbonated tea, whatever it is. So what you do is you have a liquid, right? And then we have a compressed gas, in this case, carbon dioxide. We open that gas and the container that holds the liquid is in a confined space. So there's no room for the gas or the liquid to go. So it therefore has to force the air into the liquid, right? That's really important. I'm gonna say that again. When you have inside this confined space that has pressure in this container, that if there's no more room for the gas to expand or go outward, it's actually going to go inward. It's going to go into the water, in this case, and create club soda or seltzer. In our bodies, we're using oxygen, in this case, hyperbaric oxygen. That pressure in that container also remains constant. So when we increase the pressure and turn up the oxygen is going to go into our bodies, into our fluids, into our plasma, into our intercellular fluids, into the bloodstream. So we're going to increase the amount of oxygen in our body's fluids, right? We know that, at least from birth, we're like 70% fluid or more. So there's a lot of water. There's a lot of water and fluid for our body to work with. All right, we got that? So again, don't spend too much time. Don't get too hung up on the gas laws. I just wanted to bring this to your attention for those of you guys kind of geek out like me on this stuff and want a little bit more of the specifics on that. It's not really important. All you really need to know, again, is that inside the oxygen chambers, what we're doing is we're just pressurizing the chamber, and it's a set space. And as we increase the pressure, that allows for the oxygen to diffuse and permeate into our bodies to help heal. Okay, so the next obvious question that I get asked often, and it's a question I asked when I started learning about this, is so why can't I just put a breathing mask on? Why can't I just like get some oxygen, get a medical grade oxygen tank or a respirator, or just try to increase my airflow? So let's look at that. There are a few different types of oxygen equipment. Of course, we know there's respirator tanks and regulators that divers use. There's a newer technique called EWOT. Maybe if you guys have heard of it. It's called exercise with oxygen therapy. So what it is we put a mask on while we're exercising, right? And again, that can increase your SpO2, which is your oximeter. You guys have probably seen that. We have an oximeter that you put on your finger. A lot of people are using that now for COVID to check your oxygen levels. Normal's in the 90s, it should be in like the mid to upper 90s. Anything that gets below 86 is a little concerning, but we usually like to see it. Most patients we check between 96 and 100, somewhere around there. So with this exercise with oxygen therapy, what it does is we're biking, we're running, we're on the elliptical, we're doing whatever training we're doing, we're increasing our rate of respiration, and we're trying to increase the oxygen that binds to the red blood cells to increase the oxygenation in our body inside our circulatory system. Okay, so that the point I wanted to make here, which is going to be true for the next 3 oxygen therapies, is we are limited in capacity when we do these therapies. Okay, so EWOT or CPAP or oxygen concentrators, breathing apparatus, we are limited to the amount of oxygen that we could bring into our bodies by the number of red blood cells, right? So red blood cells in our body, what they do is they carry oxygen. That's what they do. That's their job. So when we take more oxygen into our body, the oxygen molecule binds to the red blood cell and it takes it to the body, to the cells so that we can, breathe. The cells can actually breathe. So there's we max out based on the amount of red blood cells we have, right? So we only have a fixed amount of red blood cells. The amount of oxygen that we can get in through breathing is limited by that capacity. Make sense? Great. CPAP does the same thing. It's continuous positive airway pressure. This is for people who have sleep apnea or snoring, or they stop breathing in the middle of the night. So they have these CPAP machines that are basically pushing oxygen to the system. They're not super comfortable to sleep with. Maybe you have a friend or a spouse or know somebody who uses them. Same idea, right? We're putting oxygen through the lungs into the bloodstream, and that's going to improve more oxygenation, but we're still maxing out due to the limitations of the number of our red blood cells in our bloodstream, okay? Oxygen concentrators, all right? That's what people use when they have asthma or emphysema or, even ventilators that we were using with COVID. What they do is they pump oxygen into our body, into our respiratory system. And that air goes through our lungs into our bloodstream and is delivered to our cells. Again, even with breathing apparatus, we max out at 100% oxygen carrying capacity of the red blood cells. So again, if we have anemia, which means we have diminished blood volume, that means that our body cannot carry that much oxygen because we're only limited to the amount of blood that we have in our bodies. So anemia, right, is one thing that can affect, or low volume of oxygen or reduced red blood cells in the body is going to reduce the oxygen carrying capacity simply as a result of the volume of blood in the body, which is why when people get anemia, they get pale, they get woozy, they get tired, things like postpartum, post-operative, after we have a baby or something like that, or an injury, there's bleeding. So after the oxygen levels drop, our body gets cold. It heals slower because of the oxygen deprivation. We go into relative hypoxia. So that's systemic. I'm going to talk a little bit more about this in a few, but we could also have local hypoxia, where we have disruptions of blood flow, again, due to trauma or poor circulation. We'll talk a little bit more about in a few. Now, with hyperbaric treatment, what I love about this is hyperbaric oxygen is the only treatment that we know of right now where it can bypass the maximum amount of carrying capacity of the red blood cells in the body, right? So we max out at 100%. We have 100% of our red blood cells. Each one of those red blood cells gets oxygen. That's the most oxygen we can get, most oxygen saturation we can get in our body. Now, when we add hyperbaric oxygen, the oxygen goes into the body, as we talked about earlier, and enters the fluids. So it will bypass the circulatory system and oxygenate the tissue in the cells through like an auxiliary supply. It'll oxygenate the tissue through the plasma, through the intercellular fluids, water in the body. So any liquid in the body will absorb the oxygen temporarily and oxygenate the body to any areas that have lack of oxygen. And again, it creates the gradient, creates a temporary oxygen surplus, which is very useful for recovery. In this case, we're talking about vision. We'll talk about other conditions as well. So you guys got that? Awesome. So hyperbaric addresses disease that result from hypoxia, right? This is an oxygen treatment. Hypoxia, hypo means less than what we want. Hyper means too much. So oxia is oxygen. So hypoxia is too low oxygen, okay? Just to get clear on some terminology. So if we have adequate amounts of oxygen and high oxygen or sufficient oxygen or even a surplus of oxygen, the effects on our body is that we're going to have high cellular ATP energy production. That comes from the mitochondria. We're going to dive into that in a little while. But the mitochondria produce energy or in the form of ATP, and oxygen is critical to that process. You guys remember back to, was it like 9th grade science, where we talk about the Krebs cycle, the citric acid cycle, all that fun stuff. So we have high oxygen that also creates a less inflammatory environment where we have a lower acidic environment, also called acidosis. So we increase the oxygen, it reduces inflammation, and it reduces the level of acids. And again, we know too much acid breaks the body down, right? In our digestive system, we have hydrochloric acid that breaks down food. Acids are used to decompose. So we want some acids to help metabolize and break down wastes and food that we can use, but too much acid, like stomach acid or lactic acid in the body, can cause accelerated breakdown and give us health issues. So, and also increased oxygen improves function, right? When the mitochondria are moving and our energy is pumping, the oxygen levels are high, the energy output is high, that is going to result in improved function. What kind of function? Brain function, eye function, detox function, circulatory function, nervous system function, respiratory function, immune function. So any of the functions, structure or mobility function, decreased pain function. So function is health, right? Health is optimal function, optimal health. That's how we actually measure health. And long term, we know that improved function is going to result in health maintenance or longevity, health and preservation of health and function. So that's optimal levels of oxygen, either high levels or slight surplus of oxygen. So as oxygen levels decrease or they drop due to a bunch of host of factors that we're going to talk about in detail in a couple of minutes, what happens when the oxygen levels drop too low in the body, where we have low oxygen output? Again, so we don't have the Krebs cycle, we don't have the citric acid cycle. The mitochondria in the cells are not respirating, they're not producing energy, they're not burning fuel, burning glucose and producing water and heat. There's not a respiratory and metabolic activity going on. It's impaired, all right? So it's like just not getting the energy it needs to function, all right? So air is needed to function. So what happens as a result of that is the carbon dioxide levels increase, which is similar to what happens, those of you guys who are aware of global warming, that's what happens. When the carbon dioxide levels increase, we get more acid production, more inflammatory processes in our body, when we talk about our body specifically. So the inflammation has a lot of negative side effects. You guys probably know a lot about that. Inflammation is arguably one of the biggest disease processes that are talked about right now, not only in like functional medicine, naturopathic medicine, Chinese medicine. It's also very, very trendy now, and in terms of understanding in conventional biomedicine. So a lot of investigation into inflammation. But here's the thing, guys. We talked about this a couple sessions ago when we were talking about inflammation, that inflammation is an effect, all right? So in this case, more carbon dioxide, less oxygen is causing inflammation. When the acid levels increase and we get more acidosis because we have more carbon dioxide and more inflammation, that creates a rapid environment where there's more decomposition, where the body's going to break down at an accelerated rate. All right, more acid, more carbon dioxide, no bueno for the body. We don't like it. The body's not breathing. Right? It's like you hold your breath. Body's going to start to acidify. It's going to build up lactic acid. You're going to build up carbon dioxide. You start to turn blue, and your body's dying to catch a breath of air. So low oxygen, high carbon dioxide, high acid is not a healthy environment. So just think about it, guys. So do you ever have the experience where maybe you were away for a long weekend, or maybe you left something in your car on a really hot day? We had it this summer. So we came home and the garbage was left, and it was it stunk. It smelled so bad, but that was the acid and decomposition, the oxidation of food, right? We left food in the waste basket. Same thing could happen in a car. You don't drive your car, you leave some food in the car overnight, the car starts to smell. So what's the first thing we do, right? Open the doors, open the windows, get a fan going to get circulation, bring more air, right? More oxygen, more fresh air to vent the area. That's what's happening here with our body too. We're adding more oxygen, more air to this toxic, stinky environment in our bodies to help clear out some of the negative toxic gases, in this case, carbon dioxide, which our body wants to get rid of, right? We exhale carbon dioxide, inhale oxygen. We're oxygen-loving species. So what happens is the acid levels get high, the carbon dioxide levels are high, we have more inflammation, function is going to decrease because the body's not producing the amount of oxygen that it needs. So we have a loss of function or a decrease in function. We're also going to have degeneration and progressive disease processes and ultimately premature death. Right? So right now, we're living longer, right? We can all agree on that as humans. We're living longer, but not necessarily healthier, right? So yeah, we have a lot of centenarians, but just because the quantity of life is increasing doesn't mean the quality of life is necessarily increasing. Now we know the quantity of life is increasing mostly because of hygiene practices. Young people used to die from infections, from injuries, in their 20s, 30s, 40s, and our emergency care is amazing, amazing. Like the technology for trauma and emergency is really it's gone quite amazing. But outside of the realm of acute trauma care and emergency care, conventional medicine is not that great when it comes to dealing with chronic illness, right? We know that because there's people suffering with all types of chronic illness. Yes, I see the spelling error on Regeneration. Somebody knows that. We'll fix that, but thank you for noting that. So again, lower oxygen, not conducive to healthy environment. Higher oxygen, conducive to a healthy, more functional environment. So why? So we can age gracefully. Right? That's what it's about. We want to live longer, but the quality of our lives also needs to be good. We want to be healthy, want to be active. Our mind wants to be sharp, want to be able to move. We don't want to feel sick and tired. We don't feel old, right? So let's move on. So when we start hyperbaric treatment, hyperbaric treatment, let me back for a minute, is done in hours, in sessions, right? Sessions are usually from 1 to 2 hours. In clinic, we usually do 60 to 90-minute sessions. Initially, we're going to see changes when we start to oxygenate the body. We're going to see in the first 10 to 20 hours, even early on, maybe like the first 2 to 3 sessions, you can start to see some improvements. The initial benefits are usually 10 to 20 hours. That's more of an acute situation. What we'll start to see is the following. Immune activation. The immune system is going to start to kick over because we're getting more oxygen to the white blood cells. Also, obviously, to the red blood cells, and we know the immune system requires high levels of oxygen to be optimal, right? Increased energy. We just may feel more mentally alert, more physically alert. I know the first couple of times I did hyperbaric, I came out not like a caffeine, like I was buzzing, just clear, energized, not hyper, just clear. Just like my energy felt good, I felt energized. But not hyperactive, if that makes sense. Definitely felt increased mental clarity. Sleeps better because we're oxygenated, right? Our brain needs oxygen in order to make the transfer from being awake to being asleep. That requires energy. So our body needs to actually do some work metabolically to make that transition from high beta to alpha down to theta, and ultimately if we're getting into delta sleep. So that there's metabolic activity, and our hormones have to go through this process. So more oxygen available is going to make our sleep cycle a lot better, called the circadian rhythms. We're going to have pain reduction pretty fast. Why? Because again, pain is the result of impaired blood flow, right? You got a kink in the hose, so you're not getting the oxygen through, you're not getting the nutrients, you have buildup of lactic acid, right? We talk about acid, which can irritate the nerves, and we also have reduced oxygen, and it just causes more pain. Less oxygen, more inflammation, more lactic acids result in more pain. So increase the oxygen, reduce the carbon dioxide, increase the circulation, reduce the acid formation, we're going to have less pain, and reduce the inflammation. Acute burns. Okay, so check this out. I heard and read some studies that hyperbaric oxygen is really good for burns. So last Saturday, 2 weeks ago, yeah, 2 weeks ago Saturday, I was rushing around the house. I had some stuff to do, and I was making myself an omelet brunch, and I had two burners on. So the handle was actually over another burner that I turned on. I was actually, I was making a burrito. So I was taking the burrito and flipping it over on the thing. That's probably more than you guys need to know, right? So anyway, the handle got hot, right? Because it was hanging over the flame. It was a gas range. So being in a rush, not paying attention, I grabbed the handle with my hand and picked it up, and I didn't want to drop it, right? But so I, put it down, but immediately I had a big blister, and it was like red, and I felt the pain going right up to my all the way up my ulna through the nerves, and it was really bad pain, like to the point where I almost couldn't speak. It was like, if any of you guys have had like a pretty bad burn, it hurts. So I was actually on my way to take my son to the office where I'm at right now to have him do a hyperbaric session because he broke his arm. Because hyperbaric is very, very good. One of the things we use it for is a wound healing. He got a break in his elbow that we're using now to accelerate his healing. Wrestling season's coming up. He's a wrestler, so we need to get that going. Anyway, back to the burn. So I was like, all right, I kind of bandaged it up, and I was like freaking out because obviously it's Sunday and I need my hands to do acupuncture, and I'm starting to stress out a little bit. I'm in pain, and I'm like, ugh. So then, after about a minute or two, I'm, eating my omelet, finished that up, and I was about to leave my son. I was like, wait a minute. I was like, I have hyperbaric. It could, let me try it. So literally, guys, my son David went through the hyperbaric session for an hour. Then I went in for a session. Within 20 minutes, all the pain was gone. So I had a big blister. This is like 10 days out now, right? There is absolutely nothing here. There's no blister. There's nothing. So this whole area was bright red a week ago. I had two blisters, one here and one little one over here. So it hurt. It really hurt. It was definitely a second-degree burn, and it was gone. So I did like 3 hyperbaric sessions within a week. After the first session, it just blistered. It was no pain. After the time I got out of the hyperbaric session, there's no pain left. And after 3 days, it was just a slight blister. That went away. After 2 more sessions, that was gone, probably by a week, within like 5 to 7 days, totally gone. So that was my first experience that, hyperbaric can work so well for burns. So I'm excited to have had that experience firsthand. We also know, of course, we have the mitochondrial activation, which we talked about earlier, which is going to result in improved energy, improved function, sleep, all this other stuff we talked about. So that's like a short-term, short session. Like you do 10 to 20 sessions, it's more acute issue, something like that. You're having a lot going on. So when we have more chronic issues, more degenerative issues, more major traumas or something like that, we're going to need more therapy, right? As with all treatment for all diseases, I tell my patients all the time, whether it's acupuncture, supplements, whether you're going massage, chiropractic, physical therapy, whatever you're doing, the bigger the mess, the more work to clean up, right? Obvious. So the bigger the problem, the more treatment we need to do. There's more stuff that's going on. So the benefits, usually chronic conditions, usually about 20 to 40 treatments. If it's really severe, something that's neurodegenerative or a neurovascular, you got a lot going on, usually we're looking at about 40 plus hours. Now, that said, the bigger tanks that can compress more air and get like 2 to 3 atmospheres, you're going to spend less time. The soft chambers work just as well. You just need more hours. So that's really the big difference between the two. Other than, again, using the heart chambers, as we talked about earlier, for these more serious conditions that we usually recommend us, you're just going to not get the same results in a soft chamber. And if you guys have questions on that, you're welcome to reach out to me. So what happens when we really want to do a deep dive and we want to do a lot of sessions and really start to train the body and create this constant surplus of oxygen that's going to make it available to the body for healing, repair, and regeneration. So let's look at some of the benefits here when we get around to 40 plus hours. We know it raises the blood plasma oxygen tissue saturation to improve microcirculation of oxygen, right? So let me back up for a minute. So as we age and or with trauma, the microcirculation, i.e. the capillaries in our body, will start to break down. You guys may or may not know this. The smallest capillaries in our body are found where? Any guesses? You guys want to guess? Type in the comments. Where are the smallest capillaries and blood vessels found in the body? Right? The eyes, all around the eyes. So the smallest capillaries, the smallest blood vessels in the body is around the eyes. So with age, we're saying right here, with age, with trauma, and with disease processes, these blood vessels, this microcirculation will start to break down and decrease because the blood vessels either get clogged, they're little pipes, right? They're little like flexible tubes, like garden hoses. Some are big, some are small. What happens with these tubes or pipes or hoses that feed our body blood, oxygen, nutrients, and eliminate carbon dioxide and waste products is they can either get clogged or they break. You know, they're dysfunctional. So the only way pipes lose their functionality is through being clogged or breaking. So that's what happens to the blood vessels. And over time, the more microcapillaries in the micro blood vessels that start to break down and clog, we reduce the amount of blood flow. You guys can see that, right? You start to see like on your ankles, your lower legs, you start to get like varicose veins. Sometimes you can see it on our face. In different parts of our body, it starts to look purple around our feet. That is a really good example of the blood vessels losing their ability to deliver oxygen to and from the cells and carbon dioxide away from the cells. So that is the problem, guys. That is one of the main problems. And we've talked about that at length in all of our conversations. We talked about the necessity of blood flow, not only for vision, but for all health processes in our body. So very, very specific for neurovascular recovery. Again, the main blood vessels are blocked, they've broken down, they're clogged, they're not delivering the oxygen. It's like a windpipe. You know, it's basically like breathing normally. And I'm like, okay, so for the next day, I want you to breathe out of a cocktail straw. Not enough oxygen. So that's basically what your nerves and all your eyes in this case, your heart or your brain or your liver, or your intestines, whatever you're talking about, is trying to exist on this like bare minimum of oxygen because of the lack of blood flow, right? So there's significant progressive neurovascular damage. Neuronerves, vascular, the blood vessel system, right? Our circulatory system. So we see a tremendous improvement in not only oxygenation, we're talking about repair of the blood vessels. We're also talking about, obviously, more oxygen to those tissues that have not received the oxygen in a while, again, due to trauma, degeneration, or aging, right? Disease process. So we also see significantly decreased inflammation, right? Decreased inflammation because we're increasing the oxygen, decreasing the carbon dioxide. So we call that cytokine activity. Those of you guys probably read up on the COVID situation that we're dealing with right now at the time that we're doing this presentation. We have the cytokine storm, which is an inflammatory response that cascades throughout the entire body that is very destructive. Again, we need that short term. When we get sick, it can be useful to help our body deal with infection. But if our body doesn't have a capacity, cytokine activity, if we have a cytokine storm, low grade, it's okay. But like in things like COVID, that's what's killing people because the cytokines basically, it's a storm and it redlines. So it creates so much inflammation, so much dehydration, so much blood clotting that the oxygen and inflammation, the body doesn't get to breathe. It stops being able to breathe. So it's not just the lungs, it's the respiration of the cells in the whole body. So that's a big problem with COVID. If you're more interested in that, like we did some videos on COVID, or if you have any questions, you ask me about that. But this is guys, COVID is a disease of hypoxia. And this is obviously about vision, but some of you guys know, I talked to you already. We are doing a project through a company called Care Planes that is looking to help people who are dealing with COVID convalescents deal with recovery, the fatigue, the neurological symptoms, and everything like that. So we're using hyperbaric oxygen because COVID is a disease of hypoxia. So people who get COVID, one of the best things you could do, obviously quarantine and take care of yourself, but hyperbaric oxygen when you're on the recovery is going to improve your situation leaps and bounds. Okay, Next, look at the increase in white blood cell count. We know we've evaluated, and there's research that shows that the macrophage and neutrophil activity increases exponentially to fight infections and also things like cancer, right? So we're activating and stimulating the immune system or white blood cell activity. We talked a lot, and we're going to continue to talk ad nauseum about the increase of mitochondrial activity. Guys, this is really what happens. Mitochondria, again, really activate. When the mitochondria activate inside the cells, we start to have cell regeneration, cell replication, mitosis. You guys remember from like 7th grade cell biology, or if you guys went advanced and you're more into that stuff. So we have cell metabolism, cell respiration, and cell division, right? We have more cellular activity. So we want that, right? When cells get sick, they get damaged, they die, we need to replace them with healthy new cells. The mitochondria make that possible. Very, very important. Mitochondria will not work without oxygen. Mas importante. We need oxygen. So mitochondria, for mitochondrial activity is dependent on oxygen availability. We also know, we just talked about this a little while ago, is we found out recently that hyperbaric oxygen therapy can also act as an anticoagulant. Again, stroke, eye stroke, brain stroke, any blood clots in the body. Sometimes cancer patients have that from chemo and radiation. Obviously, again, COVID. What happens with COVID is the blood vessels the blood cells start to stick together and form these chains, and they clump. So they can't breathe anymore. When the blood cells start to stick together, they don't transport oxygen, and we have issues. Cells can't breathe, not good. So using hyperbaric oxygen will increase the oxygen levels, of course. It also reduces this coagulation and this clotting. So it kind of separates the blood cells so they can breathe. We also know that it fights aerobic infections, all right? I'm sorry, anaerobic infections. Anaerobic infections are like bacteria, fungus, and mold, okay? We also know it's useful for viruses. Here's the thing with fighting anaerobic infections, like yeast infections or bacterial infections. It works really well, but a lot of cases you can have a die-off. So when the good, healthy flora, the aerobic bacteria in our guts like oxygen, they're oxygen-loving. The bacteria and fungus love lactic acid and sugar. It's like cancer cells as well. Cancer does not like oxygen. Otto Warburg, I think it was 1921 or 12, I can't remember, won the Nobel Peace Prize. This German guy who found that oxygen cannot live in a high oxygen, cancer cells cannot live in a high oxygen environment. Okay, I'll say that again. Cancer cells cannot live in a high oxygen environment. That's why hyperbaric is one of the useful tools for cancer therapy as well. So again, it gets rid of these bacteria and these fungus and this mold in the body that lives on, that's anaerobic, that doesn't like oxygen. So bring more oxygen, they don't like it, it kills them, but then we're gonna have some die-offs. So with that, you may feel a little yucky for a couple of days. We gotta go through a detox protocol. We also, very, very important here, guys, it's really exciting. We know that stem cell activity, after about 20 hours in hyperbaric therapy, it's been measured scientifically that the body will increase 8 times stem cell growth, all right? It will activate the body. People are paying hundreds of thousands of dollars for stem cell activity, guys. It's not their stem cells, or they're splitting it in plasma now, which is a little bit better. But how about getting your own body to produce the amount it needs, then dilating the blood vessels and getting it to the right area that you need, right? That's the strategy. And again, stem cells, again, if you do stem cell treatment without dealing with the environment of the body, improving the health environment, more oxygen, more alkalosis, less acidosis, less carbon dioxide, less inflammation. When we improve that environment with things like hyperbaric oxygen, eating right, exercising, acupuncture, all these other therapies, when we're healthier, the stem cells will work better, right? They don't work in a sick environment. You know that. It's like trying to plant seeds in the middle of winter. You can't grow a garden in the middle of winter because the conditions aren't right. It's the same thing with stem cell activity. Again, you guys want more information on that approach, inside my YouTube page, we have a whole lecture on stem cell therapy and how that works. So you guys can watch that, and that'll give you insight as to how the stem cell activity works with hyperbaric oxygen. But guys, 8 times. It's amazing. So do hyperbaric oxygen for stem cell activity. That's what you're looking for. And again, especially with these eye conditions, retinitis pigmentosa, Usher syndrome, macular degeneration, glaucoma, even things like dementia, Alzheimer's, are doing a lot of stem cell research, and they haven't gotten very far, right? Other conditions like acute trauma, great, absolutely. But degenerative conditions, why? Why isn't stem cell working? I assert because the environment is still not healthy. It's not conducive to regrow. We clean up the environment, we get fresh air, we get more oxygen, we get carbon dioxide out, we reduce the inflammation, we reduce the acid, we get more nutrition, improve the digestive system with supplementation, we improve the whole environment. Stem cells work, grow more healthy cells. Makes sense, right? We also know that this is a pro-VEGF, right? Growth, this is a vasoendothelial growth factor. What that means is we're going to repair and regrow damaged blood vessels. Why is that important? We talked earlier that most of these disease process is a result of impaired blood flow due to trauma, degenerative disease processes, and aging. Of course, we can have things like medications and other stuff like that, cause degeneration, other factors, but generally that's what happens. So when we're stimulating this new growth factor to help repair and grow new healthy blood vessels to oxygenate the tissues, it's like we had the primary main tubes that broke and got damaged. Now we're growing healthy, new, strong blood vessels as an auxiliary pipe to supply that part of the body to get the oxygen it needs. Right? Sounds good, because it is. So let's talk about specific benefits, again, for these key systems. I want to take a little bit of a deeper dive inside this stuff. So specific vascular benefits, we talked about, so when we talk about blood volume, we talk about hemoglobin, all right? That's the blood count. We kind of get this when we do our CBC, complete blood tests, when you guys get your blood drawn. So it increases the total hemoglobin, red blood cell O2 oxygen carrying capacity, which is for systemic oxygenation, all right? So we know systemically we're increasing the oxygen carrying capacity, all right? We're maxing out whatever the body can use, the red blood cells can use to transport oxygen, okay? We also know that beyond that, we are, as we talked about, we're getting a temporary hypersaturation of oxygen to the cells and tissues that need it, that can't get it because you're already 100% capacity. So let me say that in a different way. So you get an injury, say you get a head trauma or you get an eye trauma or something like that, and your body's already pretty good at 98, 99% oxygen. You have, you're not in an anemic state. Your body's circulation is pretty good. So your body doesn't have more oxygen to put. It's using all the oxygen it has. So it doesn't have a surplus to put towards that injury, to the brain, to the eye, to your elbow, to your arm, to your burn, wherever. So what doing hyperbaric oxygen does, it adds to that 100% so we can get the oxygen to those areas that are damaged due to trauma or degeneration or sick that need the oxygen that can't get it under normal circumstances. Make sense, guys? Okay. We also talked about that it activates angiogenesis and neovascularization through the pro-VEGF that we just talked about, meaning, again, it facilitates the growth and repair of new, healthy, strong blood vessels required for oxygenating the tissue, bringing food, and getting rid of carbon dioxide and waste products, metabolic waste products. That is called the vascular endothelial growth factor. Again, it compensates for the microcirculation insufficiencies for both acute and degenerative capillary degeneration. My UK friends and British friends, that's capillary. We're also, of course, improving improving cell metabolism and cell respiration. So the production of energy is metabolism. The respiration is the breathing, all right? So we know the cells are going to breathe better. Every cell is like a miniature version of us. They need to digest, and they need to breathe, right? Produce energy, take in food, make energy, get rid of waste, and respirate as well. So both of those processes improve significantly with hyperbaric oxygen. Stem cell regeneration. So let's talk a little bit more about this. So the stem cell regeneration activation, the bone marrow stem cells increase 8 times, right? So we have this bone marrow stem cell activity. So what that does is it's also the musculoskeletal cells, right? A lot of that comes, and most of those in adults, stem cells are used for repair and recovery. In children up to puberty, teens, 20s, they're for growth, right? When you kind of max out at puberty, your growth stem cells are kind of maxed out, and we shift over to repair and recovery. So those stem cells will come from fat tissue, they will come from bone marrow, and we have our musculoskeletal systems, but we have very specific stem cells that are our central nervous system stem cells. And those two will increase. Very, very important that those cells have been measured to increase 8 times. So stem cell for the central nervous system, spinal cord injuries, brain injuries, eyes, all right? Spinal cord, brain, and eyes. That's the central nervous system. So guys, for me, even one of the reasons I even got, and this is kind of full transparency, like God forbid me or any of my family members ever had like some type of a traumatic issue where there's a brain injury, a spine injury, eye injury, or something like that, some traumatic injury. Unfortunately, right now, hyperbaric oxygen is not super widely available in hospitals and stuff like that. And I've been saying for the past 3 to 5 years, I told my wife, anything happens to me like this, a traumatic injury, I get in a car accident, anything like that, make sure you get me a hyperbaric oxygen because of all the obvious benefits. So the initial response to that was like, you know what, might as well just get one. We started using it ourselves, and now we're starting to, obviously started using it for clinic, seeing good results. So that was kind of my, because you can't, guys, if you get an injury, you get God forbid, there's a stroke or a heart attack, or you don't know what's going to happen, but having these tools available for me, for my family, for my patients is why I'm kind of into this, and why I'm sharing this information with you guys. So again, this is about after 20 hours. After about 20 hours, the research shows that the stem cells increase about 8 times. So let's move on. Local cellular tissue benefits. Okay, so we talked about the plasma oxygen levels will surpass the 100% max out carrying capacity. So again, we have the 100% carrying capacity. We can override that. We can saturate that and get even more oxygen into the body temporarily while we're in hyperbaric oxygen therapy, getting oxygen to those areas in the nooks and crannies of the brain, the heart, the liver, the lung, the kidneys, wherever the body needs it for repair and recovery. Guys, our body is always going to homeostasis. That means our body wants to repair and regenerate at all times. It just doesn't have the resources available, right? Wants to rebuild the house. Half the house got knocked down during a storm. If you don't have the raw materials, you can't rebuild the house. You can have the blueprint, which is our DNA, but if you don't have the raw materials to rebuild it, you're not going to rebuild it. And then we're going to have progressive degeneration. Rebuilding starts with oxygenation of the tissue, right? We also, again, we talked about local and systemic tissue. So we want to systemically max out our circulatory system, our red blood cells' oxygen carrying capacity. We also want to get all that oxygen to all those nooks and crannies in those areas where we have decreased volume of oxygen, again, due to trauma, due to aging, due to degenerative factors, inflammation, toxicity, whatever we're talking about. And again, so localized oxygen needs increase beyond 100% whenever we have degeneration or trauma. So this is why it's so important, specifically for trauma or neurodegenerative or any type of degenerative conditions. So the oxygen keeps the DNA active for cellular repair and regeneration, right? That's what signals the DNA, signals cell repair and regeneration. Oxygen is needed to signal the DNA to start the protein synthesis, the messenger RNA, to repair and regenerate the cells, right? You guys want to learn more about that? Some of you guys know a lot about that. Some of you know nothing about it. If you know about it, great. If you want to learn more about it, jump on YouTube or do some research. There's so much awesome, cool videos that explain stuff real easy. You can learn more about that. If you're not interested, you just want to get the results, that's great too. So let's look at the mitochondrial benefits a little more. This is the key area, guys, and it really affects mitochondria and the DNA. So increased ATP function, we talked about that. We have more energy output, more health, more function, more happy. Mitochondrial hypertrophy, guys, the mitochondria, when we start feeding the body oxygen, they grow in size. we have growth and strength. They become bigger and stronger. It's like Arnold Schwarzenegger syndrome. Those you guys don't know who Arnold Schwarzenegger is, look it up. So Arnold Schwarzenegger is like big muscular guy. So what happens is these mitochondria, they grow, they increase their capacity, right? They get stronger and more efficient at producing oxygen. We want that. We don't want atrophy. Mitochondrial atrophy, mitochondrial dysfunction, it's when they shrink and get weaker. Not good for health and longevity, right? We want to age gracefully. We want our mitochondria to be strong and healthy. That is going to help us age gracefully. It's going to help us repair. It's going to help us regenerate and stay long, happy, youthful, energetic lives. Cell regeneration cannot occur without oxygen. Activating the mitochondria to activate the DNA, again, for replication and supplicant cell division, mitosis. Critical for angiogenesis, also we talked about that. So you have to have the mitochondrial stimulation to signal the cell to start regrowing and repair the new blood vessels that are going to help deliver the oxygen and nutrients to the cells that have been starving and suffocating for a very long time. Maybe short-term, an acute issue. If you got something going on for a long time, this is why it's going to take a long time, guys. These cells, these parts of your body have been suffocating. You've had a chronic illness, in this case, chronic eye issues. You had this chronic situation where your body's not breathing into that area, right? Talk about that. You guys do meditation or hypnosis. You guys have taken our classes on Qigong. We're breathing into areas of our body. We're breathing into our eyes. We're breathing into our lungs. We're breathing into our liver, breathing into our stomach. We breathe into stress. So breathing into areas of our body, metabolically, respiratory rate, or symbolically, brings freshness and renewal into that area, okay? That's a whole different subject, but you guys get what I'm talking about. So you guys are aware, in the United States, there are 14 approved indications that the Food and Drug Administration has approved for hyperbaric oxygen therapy. There are a lot more. Overseas in Europe, there's like over 200. But the FDA has approved 14 of them. Here's the 14. Air gas embolism, okay? Gas gangrene, crush injury. That means, like, God forbid, I'm in a car accident or everything gets crushed and you can't even like repair because everything is just destroyed. So what happens again with crush injury is, of course, the blood vessels are destroyed too, so you can't get oxygen for repair and regeneration. You're gonna have to amputate, right? If you can get oxygen to that area through another mechanism, through the fluids, and bypass the circulatory system, the cell will regenerate. You won't need to amputate. Very, very significant. Compartment syndrome, acute and peripheral ischemias, strokes, eye strokes, brain strokes, retinal bleeding, right? Huge, 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 huge. Anybody with eye strokes or brain strokes that is affecting the vision, retinal bleeding, wet macular degeneration, diabetic retinopathy, all of these fall into that category. Whenever there's blood that comes out of the vessels or fluid that comes out of the vessels that should not be there, we call that ischemia, okay? Some do, some don't. Some just limited to bleeding and stroke and bursting the blood vessel. I expand that perspective there. Decompression sickness, again, that's divers coming up too fast. They get the bends. Enhanced healing and selected problem wounds. Again, my burn, my son broke his arm and he had to have a screw put in, so they put surgery in his elbow. He's about 2 weeks out. So in order to get him ready for wrestling season, we have him in that. So any wound healing, brain trauma, spine trauma, sports injuries is amazing. Enhanced exceptional blood loss anemia. Again, so we're getting more oxygen to the body. When the body gets more oxygen, it's going to produce more blood cells. Do you have anemia? Yes, we need to supplement, take some iron for sure, eat a little bit better, but the act of adding oxygen will signal the body to start producing more red blood cells because there's too much oxygen, not enough red blood cells. So the body says, hey, we got all the oxygen here. Hey, start producing more red blood cells so we can transport that. So it is a trigger, all right? It signals the body. Necrosis of soft tissue infections, osteomyelitis, right? Really stimulates the osteoblasts. delayed radiation injury. So actually we have a friend, the family that I'm working with right now that I'm working on, started with acupuncture, but she went through a radiation therapy and she has a lot of radiation, like peripheral neuropathies, primarily her legs. Like she says, it's like walking on glass every time. So we've done acupuncture. We've got like at least 50% improvement in like 3 weeks. But I really want to get her on hyperbaric. So she's just checking with her doctors. And again, I want to make sure that we want to do anything that's that any doctors have any issues with. But without question, this is going to, in my opinion, get her to 100% recovery, most likely, at very, very fast rate. Find that with the acupuncture, with hyperbaric, and we use some supplements to get her there. She'll absolutely, I expect her to have very close to, if not 100%, very close to at 100% recovery from the radiation effects from her cancer treatment. Compromised skin grafts and flaps. Again, you want to increase, you get a skin graft or something like that for burns. You want to increase the oxygen there to maximize the healing recovery. Any obviously cosmetic stuff, absolutely. There's any injuries to the face or plastic surgery, any post-op surgeries, this will increase the rate and speed of recovery. So working with a lot of doctors, a lot of physicians to help speed up the recovery, make sure the wound healing happens well. And also carbon monoxide poisoning. So that's the case you got to run to the hospital. That's when we use the hyperbaric chambers. The hard ones will really get 100% oxygen. Carbon monoxide poisoning, decompression sickness, those are types of gangrene. These are the big conditions that we're going to use medical grade hard shell chambers that are usually found in the hospitals. I'm probably going to be getting one here in our clinic within a year or so. I'm just kind of working on the logistics on that. We actually need to find space. We're having space issues, but I'm very excited to, definitely within the next year, we'll probably be acquiring a hard chamber as well. So that concludes our first part. I hope you guys enjoyed that section. Again, the first section was just to really get you guys familiar with what hyperbaric is, how it works, a little bit of a zoom out, broad perspective on what it works and how it works. The next section we're going to talk about next week, or I'm sorry, in 2 weeks, is going to talk about how hyperbaric oxygen can specifically help your vision. What conditions it works for, how it helps vision, how it helps the brain, how it helps the optic nerve, how it helps the retina, how it helps the optic nerve, how it helps the rods and cones, how it helps the fluids, how it helps with bleeding, with edema, macular edema, CME, stuff like that, acute injuries, if you get, I have patients in car accidents, or God forbid, anything, maybe you got punched and there was I had a couple patients already that had injury to the orbit and they did reconstruction that caused vision issues. So anything from degeneration to acute traumas, we're going to talk very specifically about hyperbaric and how in applications and the mechanism of action of how it works for eye-related issues. And again, as usual, you guys know, your vision is our mission. I know it's cheesy, but I love it. I love our tagline. So for more information, if you guys want to find out more about what we do, you're welcome to book a telehealth consultation if you want to have a consultation with me to find out more about your condition, see if or how we think we might be able to help you. More information on our YouTube channel, right? On our YouTube channel, all these sessions we're uploading there. They're also obviously on our Facebook page. So feel free to check those. They're going to be on-demand viewing. Check out our YouTube page. We have case studies. We have tons of patient practitioner education for acupuncturists as well and healthcare providers. We're inviting you to join our Facebook community, Dr. Rosenfarb's AccuVision community, for those of you guys who are on social media and are on Facebook. We have good educational content there as well. Conversations is a great place for you guys to drop your questions and ask questions about your specific condition, or maybe a family or friend that you're kind of advocating for that has some questions. And of course, we have our books on Amazon and our iHealth Institute, and you guys can also find out more information. We just recently updated our websites, so you can check those out at AccuVisionAcupuncture.com, and also iHealth Institute, where our products are. So I am going to stop my screen share and say thank you for joining us this evening. We hope that you learned a little bit about hyperbaric oxygen and its incredible uses. I am so excited to bring this to our list of services and our integrative model of helping people deal with eye conditions and traumatic brain injuries and sports medicine, all the useful benefits there are for hyperbaric oxygen. If you guys have any questions, please feel free to reach out to me, reach out to my staff, call, email, text, send me a DM on Facebook or whatever you guys want to reach out to me, whatever works best for you. Have a great night. Looking forward to next week, to our session, and it's going to be a good one. We're going to talk all about eye conditions. Take care, guys. Have a great night. Bye.